Some problem with the audio.
Okay, so a hearty good evening to everyone, and welcome to a session on Febrile Fits in children: when to worry and when not to worry. We are glad to have Dr. Sowmya among us today to help us understand the topic. Febrile seizure is a convulsion in a child that's caused by fevers. Doctor will explain more about the seizures and help us tackle it. Doctor, you have the stage.
Am I audible? Good evening, everybody. I'm Dr. Sowmya, consultant pediatrician and neonatologist, Apollo Cradle Hospital, JP Nagar. Today, I'm going to talk about one of the not so serious but serious for parents called febrile seizures, because the seizure is a phenomena which happens in a newborn or any new baby. It is so frightening for the parents to see. Seizure is nothing but fits. Fits are few requiring hospitalization and few requiring nothing, most of them requiring nothing. I thought I'll address to this situation so that parents know when to worry, when to rush to hospital, and when to do investigations and when not to do investigations. Seizures is a nightmare for parents. Any parent, when they see a child fitting, they go scared. They get scared and they go haywire to try what to do next. So I'm giving some tips to parents what to do when the baby is having a fit and what not to do also. Febrile seizure is one of the common seizure in a child, and that can be easily controlled without doing anything, and that is called as simple febrile seizures. This happens most of the time in a child who is around above 6 months of age and less than 5 years of age. Above 6 months of age and 5 years of age, if the child is having fever which is not even like 100, between that temperature, child is doing otherwise well, but throws a fit and which lasts less than 5 minutes, and which is not going to happen again in within 24 hours most probably, is called a simple febrile fit. This is the common thing which we see in children, and usually happens with any viral illness or bacterial illness. Commonly happens with most of the viral influenza or flu like symptoms. Usually they would have had cold like cold, cough, a runny nose, and within few hours you might feel that baby is slightly warmer, and within an hour or two child will start having a fit. That is called as febrile fit. And febrile fit usually happens in generalized, means the whole body will be involved, where head and hands and limbs start shaking, or child may hold their hands tight and look up towards the sky, up rolling of eyes, neck can go backwards, and they will also sometimes defecate and urinate, and they will have frothing in the mouth, and sometimes even excessive salivation. They start gurgling, that is the sound which comes. So this is called as febrile fit. And having high fever. So if you are having tight clothes, and if it is fitting, it might get restrained. So you just try to loosen the clothes, take off, turn on the fan, let the fever evaporate. Take lukewarm water and try to sponge the baby. Do not use cold water. It might, and some parents start putting cold packs on the forehead or even alcohol to make them feel cool and all. It's not advisable. Instead, use lukewarm water to sponge, and give paracetamol
The doctor will be back in a second. There seems to be some technical issues. We will be back soon.
Hello, there was some short break. What I was telling is when a child fits, you please make sure that child is being made comfortable than doing anything. Even some people give iron things to the hand; those things will not help because febrile seizures, being simple febrile seizure, what I called, is going to last less than 5 minutes most of the time. Very rarely more than 5 to 10 minutes. So it is a self-limiting thing. Only we need to let the brain hyperactivity to get better, and it stops by its own. So only comforting the baby. Do not restrain. Do not hold it in your arms. Do not try to stop the movements of the hands and limbs. It will stop on its own. Second thing is, most of the time they will have viral upper respiratory cold, cough, such things. So you are rest assured that it is nothing but a simple febrile seizures. And after 10 to 20 minutes, little drowsiness is expected. Child will have some delirium. Child will blabber sometimes, and after half an hour, it wakes up. It's on its own. Child is managing. It wouldn't remember what has happened. This is called simple febrile seizures. But in a complex febrile seizure, what happens? Child will have several episodes of such febrile seizures within 24 hours, and it might start with one hand twitching, then sometimes only for face twitching like this is called as focal fits, which is unlikely to be a febrile seizure. So in that case also we should be little worried. And if the convulsion is lasting more than 20 minutes, if it is child is drowsy unusually even after half an hour, or after half an hour child wakes up and you see that hands and limbs, one part of the body is not able to move, in that case, or unusually drowsy, irritable, child starts vomiting, and if it is a little older child might complain of headache, giddiness, such things we have to be little cautious because it doesn't fit into simple febrile seizures. Age group, as I told you, 6 months to 5 years is common, but most of the time we see it less than 2 years, and first episode would be most of the time less than a year. So all this viral flus, sometimes they get cold, no, so you should be careful with fever. If they have rigors like chitteriness, chills, these are not for convulsion, they are called seizure mimics. They mimic seizure but they are not seizures. Here they are just tremors. If you hold, it will stop. That is not seizure. So do not panic if your child is having seizures or rigors when they have high fevers. That is taken as seizure mimic. Even breath holding. Sometimes babies they cry a lot and they become blue and they start holding their breath, look up, they uproll their eyes, and they lose consciousness for few seconds. But on tapping, they take their breath back and they come back to their normal. That is called as breath holding spell. That is also not seizure. Some anoxic seizures can happen, like some babies take injection, they stop breathing, and then they lose consciousness for a while. That is also called normal. That is not called as a fit. So risk factors, if you want to know, common risk factors are family history. Most of the cases, like there is this genetic workup has been done. There is a genome which is attached to these febrile seizures with people have family history. So if you have family history, then you should be careful with Hello, there is some communication error. So we were talking about seizures when risk factors. If family history is there, then risk is more. Male children are more at risk, and some even studies say that iron deficiency, anemia being there, zinc deficiency being there, these can cause febrile seizures, but none of them have proven. Even there are some studies saying few viruses as such can cause febrile seizures. This doesn't depend on how high the temperature. Usually, it happens when the child is having fever of 100, 100.4. This is the northern temperature also. So we are not sure what triggers fever. Studies are not to worry because it is not associated with any developmental consequences or any cognitive errors or scholastic performance. Child will do well even if your child has had several 1 or 2 episodes of febrile seizures. Do not worry. Most of the time, when your child gets a first episode of febrile seizure within 15-16 months, likely to have another episode in the next year. At least 1 in 3 children will have another episode within a year. But in general population, if you get epilepsy in future, fits disorder in future is the common question, anxiety which the parents have. In such thing, answer would be like if in a general population, if anybody can get 1 in 100 can get a fit, but in a child who is less than simple febrile seizures, chance is that 1 in 20% only you can land up in having epilepsy. But if it's a complex febrile seizure, which I spoke to you, having several episodes of seizures in a day and lasting more than half an hour, not triggered by fever, sometimes fever is very low, or if there is any paralysis or anything, then they might have more chances of getting the fit like seizure disorder, and they might have to go for long term treatment. When to go to hospital? See, first episode always you go to hospital because you don't know whether it is just a simple febrile fit or it can be hypoglycemia, means your child sugars must have gone down or calcium must be low, electrolyte imbalance might be there, or even it can be a serious illness like meningitis, which is brain fever, brain abscess, and brain tuberculosis. So nobody knows first episode whether it is just a simple febrile seizures to give you assurance and to sit at home. So first episode you go to hospital. There doctors will take a thorough history about your child and clinical examinations will be done. If we find that there is a focus that child has had, most of the time it is viral infections or ear infection, tonsillitis, pneumonia, something which is there, which has started the fever, and fever has caused a convulsion. There are few things, sometimes even with a vaccine it can happen. It is not the vaccine which has got the convulsions into, but it is the fever which is got by the vaccine and which leads to convulsions. Most probably with measles, mumps, rubella, or with chickenpox vaccine, or even with DPT. We have seen fever going high, and then they might throw a convulsion. But it is, you need not worry about vaccine and stop taking vaccines. It's the fever which is likely to happen, and that is the age group which they fall into. So do not hesitate to take vaccine if your baby has had a febrile fit after a vaccine. When you have to go to hospital less than 6 months, we will hospitalize the baby. But between 6 months to 1 year, we observe the baby for few hours, send some investigation if we have a doubt, and then rule out electrolyte imbalance, dehydration, calcium, island, sugar deficiencies. Then correct the child. At last, we find the child is going to have a focus of infection, we'll be sending you home. But if the child has had breathlessness, because after a fit, child might have taken a secretion which pulls out consciousness lasting more than half an hour, child is unable to wake up, child is having any injury, like you during a fit, if you hospitalize them to get hospitalized, or if the child has got several episodes of convulsions, and even if it is lasting at least 30 minutes, we need to put the baby on IV and then observe the baby in the hospital. When to investigate? We won't be investigating. I've seen several babies getting this big investigations being done, several lists of investigations, which is not recommended. If we feel it is a simple febrile seizures, we hardly do any investigations because we know the focus on clinical examination and we know the history and it's fitting into simple febrile seizures. But if it is some doubtful case, we do investigate for electrolytes, calcium, magnesium, and sugar levels. And if the child has had a high fever and without any focus, we might also rule out where is the urinary tract infection. Is the focus there? Or if the child is 6 months old, unconscious, and if the child is very sick looking, we might have to admit to do the lumbar puncture. Lumbar puncture is a procedure where we put in a needle in the back to take some fluid from the cerebrospinal fluid and then examine to look for meningitis, that is brain fever, and brain abscess if it is focally thing. Then few cases only we need to do EEG and MRI. When is EEG needed? I see some people getting conversion today, tomorrow they are doing EEG and coming, whether to see whether they have fit seizure disorder. So that is not recommended. 2 days we would wait because seizure activities in the brain, everything post-ictal means post-seizure. There will be some abnormal brain discharges. Let them all settle. And if it is fitting into complex febrile seizures, we as doctors we will recommend you do not go to do EEG. MRI is hardly advised until unless there is consequences like post seizure, some deficit being there, or we notice there is some either neurological fever symptoms or any intracranial lesions being suspected. In such cases only we do MRI. Otherwise, we don't recommend any investigations. Treatment at home, what to do, is one of the commonest thing when the baby is having fever or febrile fit. What to do? See, always treat the fever. See, even several studies have told even if fever is not there, sometimes they do throw convulsion. But always to calm the baby, to release the discomfort. That is the only reason we give paracetamol. Why fever is a protective phenomena in your body, which helps your body to fight the virus or the bacteria. So do not have to be so scared and start giving all the medications at a time to reduce the fever. Safer is paracetamol. Give paracetamol according exact dosage. By giving high dose also it doesn't help. Give proper dosage as recommended by your pediatrician. Wait for few minutes. It doesn't act immediately. Take lukewarm water to sponge the baby. Do not use any ice pack. Don't put any putty just on the forehead. Take lukewarm water, sponge the whole body, turn on the fan, let the temperature evaporate to reduce the discomfort of a child. And second line would be ibuprofen. Do not use if the baby is already dehydrated or sick looking or if the child has rashes, because they have drugs have their own side effects. Fever se zyada, the risk is with the drugs, so try to use drugs judiciously and only when needed as advised by the pediatrician. Rectal paracetamol, that is anal, we give suppositories that can be inserted. Only difference is it bypasses the circulation GI and it enters the circulation faster, giving better relief. And those who are vomiting, those who are unable to take orally, giving per rectal suppository will help temperature to get better. Second is do not give any medications or do not try to put anything in the mouth. And second, nowadays only because children parents panic, those who are getting repeated episodes, we previously used to give rescue medications. Rescue medication is if the child has had a seizure, if they are panicking that it might happen in the next febrile episode, we used to give some tablets to reduce the febrile episodes. See, not febrile episodes, but the convulsions. But nowadays, even the several studies have been done that it is of no use. So we have stopped giving any tablet for febrile seizures. Only those who get repeated episodes or those untriggered seizures they are getting, for them we are giving rescue medications in the form of nasal sprays of midazolam, which we give only for those who really are staying far away, who can't go to hospital immediately, or if the child has had several episodes in the past. So, who is on prophylactic treatment, then such kids we are giving intranasal midazolam, because even if that is given in the more higher doses, child becomes highly drowsy, sleepy, and child may aspirate more. So, everything should be used cautiously. The take home message is not to worry. Febrile seizure is a simple thing, and if you are bed out, you always go to hospital when the fever at some kind of abnormal movements if you notice, and record the seizure if you have time. Do not panic, and you get time to turn the baby to the side so that drooling doesn't happen. And carry the baby safely without any surroundings should be very clean and no harmful objects should be there. Once you reach the hospital, most of the time it would have subsided. If it continues, doctor will take care. And no worries that it will become seizures, disorders later in life, nothing like that. Most of them will be seizure free after second year itself. Very rarely, 1 in 3 cases might have a second episode. So, the take home message is febrile seizures are simple febrile seizures. Do not panic. Stay calm. Don't take it as a nightmare. All the best. Thank you.